For decades, the standard advice for achy arthritic joints was simple: rest them, protect them, don't load them. And if you're one of the millions of people living with creaky knees or stiff hips, you probably followed that advice religiously, thinking you were doing the right thing for your body. But a landmark scientific review published in the British Journal of Sports Medicine looked at over 215 studies and came to a conclusion that flips that old advice completely on its head. It turns out that resting your joints might be the very thing that's making them worse. Welcome to Longevity Lab. I'm Claire.
And I'm Robert. Claire, I have to say, as someone who's been dealing with a grumpy knee for the last 5 years, the moment you said flips the advice on its head, my ears perked up. I've been babying this knee. I stopped my morning jogs 3 years ago because my doctor at the time said, "You're 62, your cartilage is wearing down, you need to preserve what's left." And honestly, the pain didn't go away, it actually got stiffer.
Robert, your story is exactly why I wanted to do this episode, because the evidence now tells us something profoundly different. A 2022 Umbrella Review, and for listeners, an Umbrella Review is basically a study of studies, the highest tier of evidence we have, analyzed data from hundreds of trials involving tens of thousands of participants with osteoarthritis. The finding: structured appropriate exercise does not wear down cartilage, it protects it, and in many cases, it reduces pain more effectively than pain medication.
Wait, exercise protects cartilage? I thought cartilage was like the tread on a tire. Once it's worn down, it's gone. You have to drive less to make the tires last longer. That was literally the analogy my old doctor used.
And that analogy, the tire tread, is precisely where the myth lives. Cartilage is not inert rubber, it's living tissue. The cells inside your cartilage, called chondrocytes, are constantly working to maintain and repair the extracellular matrix. That's the structural scaffolding that gives cartilage its shock-absorbing properties. But here's the key biological mechanism. Those chondrocytes don't have a direct blood supply. They rely on the movement of synovial fluid to bring them nutrients and to flush out metabolic waste products. It's a diffusion pump system. When you compress and release the joint, when you walk, when you squat, when you move it through its range, you're literally squeezing nutrients into the cartilage and squeezing waste products out.
So when I stopped my jogs and started sitting more, I basically turned off the nutrition delivery system to my own knee.
You cut off the supply line. Exactly. And this is why so many people with osteoarthritis enter a vicious cycle. The joint hurts, so they move less. Moving less means less synovial fluid circulation, so the chondrocytes become starved, and the matrix degrades further. The degradation causes more pain, so they move even less. And the cycle accelerates. The review I mentioned found that physical inactivity is an independent risk factor for both the onset and the progression of knee osteoarthritis, meaning lack of movement itself contributes to the disease.
Okay, so the mechanism makes sense, but what about the pain? If my knee is already inflamed and sore, isn't loading it just going to aggravate the inflammation? Every time I've tried to do bodyweight squats in the last couple of years, my knee has swelled up the next day. That felt like clear feedback from my body saying stop.
And here's the finding that surprised me most when I first came across it, because I used to think exactly the same way. Pain does not equal damage. In osteoarthritis, the correlation between what you see on an X-ray, the structural changes, the joint space narrowing, and the amount of pain a person actually experiences is surprisingly weak. Some people have horrific-looking X-rays and report almost no pain. Others have minimal visible changes and are in constant agony. What drives pain in osteoarthritis is far more complex than just bone rubbing on bone. It's a mix of low-grade synovial inflammation, sensitization of the nervous system, muscle weakness around the joint, and what researchers call central sensitization, where the brain and spinal cord essentially turn up the volume on pain signals.
So the pain isn't necessarily telling me I'm causing more damage.
Correct. And this is where the evidence gets really compelling. A 2023 randomized controlled trial published in the Annals of Internal Medicine took a group of patients with moderate to severe knee osteoarthritis and put them through a progressive strength training program. Squats, leg presses, the kind of movements that load the joint, compared to a control group that did only low impact mobility work. The strength training group reported a 40% greater reduction in pain scores after 12 weeks. And MRI imaging showed no acceleration of cartilage loss, none, zero. The loaded group had less pain, stronger muscles supporting the joint, and no additional structural damage.
A 40% greater reduction in pain from the thing everyone told them not to do. That's wild. Okay, but then how do you do it safely? Because I'm sitting here thinking, if I go try to do a heavy leg press today with my knee the way it is, I'm probably going to hurt myself. The intention matters, but so does the execution.
You're absolutely right. And this is the critical nuance. The evidence isn't saying just push through the pain no matter what. It's saying that the right type, dose, and progression of exercise produces a therapeutic effect. There's a concept in rehabilitation science called the envelope of function. Think of it as a zone of loading that your joint can handle without crossing into tissue irritation. Below the zone, you're underloading. That's where you've been for the last 3 years, Robert, and your joint has been starving. Above the zone, you're overloading. That's where you get acute flares and swelling. The goal is to stay inside the envelope, and over time, that envelope actually expands. Your joint's load tolerance increases.
So I need to find the Goldilocks zone, not too little, not too much. How do I actually figure out where that is?
Great question. There's a practical guideline that researchers use, and I think it's one of the most useful tools a listener can take away from this episode. It's called the traffic light system for exercise with arthritis. Green light, you feel some discomfort, some achiness in the joint during or after exercise. That is expected and actually okay, as long as it's not sharp or stabbing. It should settle within 24 hours. Yellow light, moderate pain that does not settle within 24 hours. That means you likely did too much. Step back, let it calm down, and try again at a lower dose. Red light, sharp stabbing pain during the movement itself, or significant swelling and warmth in the joint that lasts more than 48 hours. That's a sign to stop, reevaluate, and of course, have a conversation with your doctor or a physical therapist.
Green, yellow, red. That's something I can actually use. My old rule was just any pain means stop. So I've been living at stop for years.
And that old rule, while well-intentioned, has likely contributed to the weakness in the muscles around your knee joint, Robert. When those muscles, your quadriceps, your hamstrings, your glutes, become weak, they're no longer absorbing the shock that they're supposed to. More force transmits directly through the joint itself. Strengthening those muscles is like installing better shock absorbers on a car. The road is still bumpy, but the chassis doesn't feel it.
That shock absorber analogy, that clicks for me. So what are the specific movements that the research supports? Because I imagine it's not just any exercise. Running a marathon probably isn't the answer.
No, and this is important to clarify. The evidence base strongly supports 3 categories of exercise for osteoarthritis management. First, Strength training, particularly for the muscles surrounding the affected joint. For knees, that means quadriceps, hamstrings, glutes, and calves. Second, aerobic conditioning, walking, cycling, swimming. Multiple large cohort studies have shown that regular walkers with knee osteoarthritis have slower rates of functional decline than non walker. And third, what gets called neuromuscular exercise. This is movement training that focuses on quality of movement, joint position sense, and stability. Think slow, controlled step downs from a low platform, or practicing a squat while keeping your knee tracking properly over your foot rather than caving inward.
Walking I can do, but the strength training part, what does that actually look like for someone who hasn't done it? I know there are listeners right now thinking, I'm not going to a gym and lifting heavy barbells with my arthritic knees.
And I love this question because it lets me say something that might sound surprising coming from a health science podcast. You absolutely do not need a gym. The research shows that bodyweight exercises, when progressed properly, produce meaningful improvements. A simple home program might look like this. Sit to stand from a chair. That's essentially a supported squat. Done slowly, maybe 3 sets of 10 repetitions. Wall sits, where you lean against a wall with your knees bent to about 45 degrees and hold for 20 seconds, building up to longer holds over time. Step ups on a low step. The key is progression. If you do 3 sets of 10 chair stands and it feels easy, you either add a slightly lower chair, which increases the range of motion, or you slow the movement way down, increasing time under tension.
So it's not about intensity in the way we usually think. It's about consistency and gradual progression. I can do chair stands in my living room. I can do wall sits while I'm waiting for the kettle to boil. That's actually not intimidating at all.
Exactly. And let me bring in another dimension of the evidence that I find genuinely fascinating, because it connects to the longevity theme of our entire show. There's a massive body of research on what are called blue zones, the regions around the world where people live extraordinarily long, healthy lives, with very low rates of chronic disease. Okinawa, Japan; Sardinia, Italy; Icaria, Greece. And here's the relevant piece. These populations almost never develop the kind of disabling osteoarthritis that we see in Western countries, but they also don't exercise in the way we think of it. They don't go to the gym.
Right. I remember reading about this. They just move all day.
They move constantly throughout the day through a full range of motion, often against resistance, working in gardens, squatting to cook or socialize, walking up and down hilly terrain. Their joints are loaded regularly, but never excessively. It's the opposite of the modern pattern, where we sit for 8 hours and then try to compensate with one intense hour at the gym, a pattern that for an arthritic joint can actually be quite provocative.
The sitting then burst pattern. I'm guilty of that, or I was before I stopped moving entirely.
And this is where the public health messaging could shift so helpfully. Instead of thinking of exercise as something you have to do in a separate dedicated session that you either dread or avoid, the science suggests that for joint health, cumulative daily movement is profoundly protective. 3 10-minute walks spread across the day may actually be better for an osteoarthritic joint than one 30-minute walk, because you're nourishing the cartilage through 3 separate compression release cycles rather than one.
Little and often. That's a message I can get behind. But Claire, let me ask you the question that I think a lot of listeners my age are wondering. If I've already got arthritis, I've already got years of wear and tear, as the old framing called it. Can this approach actually reverse anything, or am I just slowing down the inevitable?
That's the question, isn't it? Let me be precise about what the evidence says. We do not currently have evidence that exercise regrows lost cartilage in humans. That would require regeneration of tissue. And while there are some early stem cell and scaffold therapies being investigated, we're not there yet. But here's what the evidence does show. Exercise can increase cartilage thickness in specific regions of the joint, likely through improved hydration and matrix production by those chondrocytes we talked about. It reduces synovial inflammation. That's the low grade inflammatory soup inside the joint capsule that drives ongoing damage. It strengthens the periarticular muscles. And perhaps most importantly for quality of life, it recalibrates the nervous system's pain processing so that the same structural state generates less pain.
So it's not that you reverse the arthritis, you just make the joint a much better place to live, functionally speaking.
That's a beautiful way to put it. You create a healthier joint environment, and for most people, that translates into less pain, better mobility, and the ability to do the things they care about, playing with grandchildren, gardening, traveling without dreading the stairs at the train station. Those are the outcomes that matter, and those are the outcomes that the research consistently shows. Exercise improves.
Okay, I'm genuinely motivated. So if I, Robert, 60 something, with one grumpy knee, wanted to start tomorrow morning, what's my step one? The actual specific first thing.
Step 1. Pick one thing. Don't overhaul your whole life tomorrow. If you have been mostly sedentary, start with a 10-minute walk, flat terrain, comfortable pace. Do that every day for a week. And see how your knee responds using our traffic light system. Green light meaning some mild achiness that settles within a day. Then the following week, add 5 minutes per walk or add a very slight incline. Step 2. Add one strength movement. I would start with a chair stand because it mimics a movement pattern you already do dozens of times a day. Sitting and standing. 3 sets of 8 to 10 reps 2 to 3 times per week with a day of rest in between. If you can do those easily, progress to a lower chair. Step 3. After a few weeks, when that feels manageable, add a second movement, maybe a glute bridge lying on your back on the floor, lifting your hips. That strengthens the posterior chain, which takes load off the front of the knee.
Chair stands, glute bridges, walking. That's it. That's my new protocol.
That's it. And Robert, I want to emphasize something. If at any point you get persistent swelling, sharp pain that doesn't go away, or if you just feel unsure, please have a conversation with a physical therapist or a sports medicine doctor. The research gives us the map, but your own body's response gives you the personalized route. I can tell you what the evidence says for thousands of people, but your specific joint, your specific history, that's between you and a clinician who can assess you in person.
That feels responsible. And honestly, I think my old doctor's intent was good. He was trying to protect me from pain. But the science has clearly moved on from rest and protect to load and adapt, and it makes intuitive sense. We know muscles get stronger when you challenge them. We know bones get denser. Why would cartilage be the one tissue in the body that falls apart if you use it?
That's exactly the paradigm shift. And it reminds me of a quote from one of the lead researchers in the osteoarthritis exercise field. She said, "Cartilage is not a shock absorber that wears out with use. It's a living tissue that thrives on load as long as that load is applied in the right dose. We have been treating joints like machine parts for too long. They are biological, adaptive, and they respond to the signals we give them."
Signals. Today's episode has completely reframed how I think about my knee. It's not a broken part I'm trying to preserve. It's a living system I need to feed with movement.
And that brings us to our one takeaway for today. If someone listening only remembers one thing, let it be this. Your joints are not made of inert material that wears down with use. They're living tissue that requires movement for nourishment. Appropriate progressive loading is the most evidence-based intervention we have for reducing pain, improving function, and protecting cartilage and osteoarthritis. Use the traffic light system to guide your intensity. Start with walking and chair stands and let your joint adapt. Today's rule, move to nourish, not to punish.
Move to nourish, not to punish. I love that. And I'll tell you what, Tomorrow morning, instead of sitting on the couch with my coffee and waiting for the stiffness to ease up, I'm going to take my coffee outside and walk around the block first. 10 minutes, flat, nothing heroic, but I'm going to break the cycle.
That's genuinely wonderful, Robert. And to everyone listening, if today's episode shifted something in how you think about your joints, share this with someone who might be trapped in that same rest and protect cycle. And if you want more evidence-based health insights that actually make your life better, subscribe and hit the bell. We release a new episode every single day.
And consult your doctor if you have existing joint conditions. Don't just take our word for it, but take the science with you to that conversation. See you next time on Longevity Lab.